Okay, so to start off, I think the first introduction I would say is that I've worked in both the UK and Malaysia, and therefore I have an experience in managing a series and a wide range of skincare types, including from skin type 1, which is Caucasian fair skin, to skin type 5 or 6, which are Malay, Indian, and African skin. Now, all these skin types are very different based on the Fitzpatrick skin type. However, you would also want to know about all the other things about what are the basic skincare tips that you need to look after your skin well. So in the next 15 to 20 minutes, we'll be talking about how you look after skin health, skin hydration, your skin type, and the kind of skincare that you require. And if you are born with troublesome skin, can that be corrected? So first of all, let's go through the 5 basic types of skin. So of course, everyone would love to have normal skin, which is clean and not sensitive. The second type is sensitive skin, which is basically the commonest complaint that I get from my patients with regards to burning, stinging, and redness, especially after using a product or any sunblocks or anything at all. This is common even in people with normal skin if they've just had a sunburn, okay? But the only difference being that the sensitive skin type is there permanently. The third skin type is, of course, dry skin, which I'll cover in a while, and it's to do with the skin barrier being very easily broken and therefore easily inflames and gets itchy. Then you have oily skin, but oily skin throughout the whole area, the T-zone, the cheeks, and the whole face. And this is when your sebaceous gland, the oil secrete gland, is overactive and is often accompanied by lots of pimples, acne, inflamed lesions, and pigmentation as a result. And finally, the combination skin, which is the very challenging kind of skin because it confuses a lot of people. You have oily skin in the section of the T-zone and dry skin on the sides. So therefore, if you use something for acne, on the center, it's fine, but on the sides, it will produce sensitive skin, which is very eczema prone, meaning inflammation prone. On the cheeks, it will be fine, but when you use it in the close attention, if you have combination skin type. Okay, now in terms of the products that you should be using, I always say when patients are under treatment, they would have to be very careful because even though you have a particular skin type according to the 5 types that we talked about, it depends on a few things. Number 1, diet. If you're taking a lot of fried foods, chocolates, high carbohydrate diet, when you were locked down, your face was probably less oily. Okay, and maybe a little bit drier because you're always in air conditioning. As soon as we were released from prison, so to speak, you come out, your sun exposure, you have more activity, exercise, going out to eat, reach for, and therefore the skin type will change. So that is just one example. There are also other patients of mine who are pilots who might be traveling across 3 different weather zones, to the UK, to Australia, and then back to Malaysia again. And that is when their skin becomes very confused. Sometimes it produces oil, sometimes it's too dry, sometimes it's too sensitive. So knowing the basics of these 5 skin types, it is important to recognize that you do not only use one set of skincare products. Some of these pilots, as stewardess, the secret that they have is actually they have 2 or even 3 different product ranges for the different skin types that you go through in different environment and in different parts of your life. So the other common thing is when you're young, in your 30s, you might be using something for oily skin. And when you start getting older, you have to use more towards the sensitive and dry type. And so again, just because the skincare product works for you when you're younger, you should not be assuming that that would be the case for the rest of your life, okay? So now these are the active ingredients that can be used to correct changes or defects in your skin. And the commonest being salicylic acid, which you would have heard of for acne, to exfoliate the skin and to correct the oil secretion a lot more. L-ascorbic acid is also known as vitamin C. It's a very good antioxidant to prevent photoaging and also as an anti-inflammatory to prevent sensitivity. The other acids like glycolic acid can be used for more sensitive skin to increase hydration levels and so on. So this is basically a chart that's quite busy, but you can have a look through in your own time to look at what you can do and how you should choose the different products. Now, hyaluronic acid is a naturally produced substance from our collagen in the skin, which helps to draw moisture to that area. And so it always works well in most skin types, including oily skin. Because the problem with oily skin is if you overwash it and the skin surface becomes too dry, your body will naturally try to fight that and produce more oil, causing more congestion. So these are the basic order of what you should do with your skincare. Number one, wash your face, either gel type for the oily skin type or the cream type for the more kind of sensitive skin type, or hybrid, where you can use the gel but maybe less concentration or less frequent for the slightly oily type. Okay, so it all depends on your skin condition at that time. Secondly, if there's any problems, for example, acne spots, you want to apply benzoyl peroxide or antibiotic solution, it should be applied first to enhance penetration of the product into the skin. Thirdly, you can apply moisturizers, which are in the mainstay to protect the skin, and sunscreen. And finally, makeup to cover up anything whilst the repair process is going on. So what is the most important thing in any basic skincare? Without having to say it, ultraviolet protection. Why? Although UV light is beneficial for us to produce vitamin D, D for donkey in our skin, it causes photoaging through UVA, it causes sunburn, it can cause skin cancers and wrinkles. The common misconception is that when you put SPF 50 products on, that I'm bulletproof, I can walk into anywhere and I'll be fine, protected for a long period of time. But the truth is, when you start swimming, when you start perspiring, it starts to thin out. And therefore, you should be applying sunscreens every 2 hours. Okay, every 2 hours, you heard me right. Now, no sunscreen can block 100% of all the UV rays. So additional measures such as having hats, sunglasses, and clothing is very useful to prevent any further aggravation. Now, the way UV causes damage is it goes through your skin. It then causes your stem cells at the basal layer of the skin to break down, causing it to be damaged with free radicals. And that's why you hear things like vitamin C, you hear things like glutathione or antioxidants to try and repair the areas so that your DNA doesn't get damaged permanently. Second, understand your skin type. And I think this would be the third time I'm saying this, and I think it's very important. And your skin type may change with time. So, number two, get your basics right. Cleanser, sunscreen, moisturizer. Establish a morning and evening routine, just like you would brush your teeth and floss your teeth, and you would put moisturizers on dry skin if you had one. This skincare on the face is very important. To look after it and to maintain it, it will give you a very rewarding feedback at the end. And finally, you would also have to consider certain devices that can be very helpful at home through self-maintenance. So there are various devices now that helps to stimulate lymphatic flow, massages, things with some radio frequency, vibration devices, and also cleansing devices that can help to maintain your skin before it slowly deteriorates. Okay, so this is a DIY home kit. And I think later on, perhaps the ELKEN spokesperson can talk to you more about the other devices. Now, to understand how the skin reacts, this is your normal skin barrier. You can see that the outer layer of the skin, there's a fatty layer that protects the bricks and the mortar. So the skin cells in between are stuck together by concrete, and they have to be stuck together so that there's no loss of water. So this is what normal skin should be like. If you do not put an appropriate moisturizer or protection on the top layer of the skin, and nothing to enhance and enrich the skin, and in fact you use the wrong cleanser, which causes the top layer of the skin here to strip off, then the water evaporates, the skin gets dry, and other things from the outside can go in, where you can get bacteria, inflammation, and irritation. This is the first step of the inflammation that results in an abnormal skin barrier. These are pictures of skin barrier which are inflamed, which are broken, and especially here on the right, you can see infected skin. So it's very important that you prevent it before it gets to this stage. Now, moving on to the other common skin condition is that of having excessive oil production. So firstly, you have the oil excess secretion here called the sebaceous gland, which serves to be released into the hair follicles and provides a layer of waterproof on top of the skin to prevent moisture loss. Now, when the sebaceous gland overproduces oil, you start getting a microcomedone. And secondly, you will get a comedone where the skin is actually blocking the oil production, resulting in a volcano situation developing. Further on, it will get inflamed and infected here, where there's pus underlying that. Now, it's true that you shouldn't be squeezing your pimples, because when it's this big and you try and squeeze it, the inflammation will then cause more pitting and scarring, where you end up with holes in the skin. So the corner will end up with a hole like that, and those things will need lasers to repair. Whereas in the first place, if you don't pick at those, but you apply correct products, it can help to improve the condition. Now, what else can trigger acne here? Diet, too much milk, chocolates, fried foods, sweet stuff can aggravate the condition. Secondly, hormonal. So if there's certain conditions like polycystic ovary syndrome or PCOS, you can have excessive testosterone levels in your system, especially for females, which can cause acne, hair growth, abnormal periods. So these things should be searched for and considered if you have very bad acne. These are pictures of severe acne, and unfortunately, some of which have developed into scars called keloids, which will require injections to repair them. So in the first place, if you can prevent the problem of the microcomedones forming, then you can solve this problem. Moving on to the skin aging part. So you can see the skin on the right side being much more shiny, tighter, less wrinkles. Reason, more collagen, less sun damage. So let's move on to this is a skin specimen cross-section where we cut the skin, and you can see the two skin specimens here. Number one, the skin layer here is much thinner now compared to here, okay? But these are in microns. So when you look at it, you can start to see that this is a younger skin with natural curves in and out, whereas this is flattening of the skin. Secondly, there's pigmentation that's increased here. And thirdly, the collagen and elastin is broken down in this area, forming a very disorganized array of cells that are tangled up. Whereas on this side, the collagen is very tight and healthy. So what causes this? UV damage, oxidative stress from pollution, okay? So these are the things that you need to look out for. UVA, UVB, smoking, stress, sunlight, and of course, radiation. So how do you counteract the effects of reactive oxygen species? Number one, high-dose vitamin C, topical vitamin C. Number two, oral products that can induce repair to the reactive oxygen species. There are certain active sunblocks, which besides blocking the sun out, it can also help repair the skin layer, which can lead to wrinkling and aging. So let's have a look at the photos on the top here, where my cursor is. And you can see that on the left, the skin is very dry and cracked. And on the right here, the skin is well hydrated. Now, this is actually skin of the same person 5 to 10 minutes apart. It just shows how much moisturizers can do for you by putting it on consistently and on a daily basis as a habit. It can reduce aging and appearance of fine wrinkles. Just moisturizer. Secondly, the photo on the bottom here, the question that is asked here is whether if you're born with bad skin, can you reverse that with the correct products? And the answer is yes. Why is that? Because these are twins, and the twin on the left has been having a good life, but of course she doesn't smoke, she doesn't go much in the sun, and she uses cosmeceuticals or cosmetic products to look after her skin and to maintain. The patient on the right here smokes, goes in the sun, and has had a hard life working out in the sun all day, and she hardly uses any sunblock or any products. So this is very promising because it reassures us that God has given you some genes which may be not too good, but you have products out in the marketplace that can help you maintain healthy skin. And given the right approach with sun protection, positive attitude, antioxidants, and good lifestyle, your skin can be younger by 5 or even 10 years, as you can see in this photo here. So with that, those are my slides that I would like to share. And I'll be more than happy for anyone to ask me questions later on and even after the talk. You can post the questions on, and I'll be happy to answer them in due course. Thank you.